Case study in homeopathy, the pathology of rheumatoid arthritis and Still's disease. Rheumatoid arthritis is a multi-system disease characterized by persistent synovitis in peripheral synovial joints. Some patients may only have a mild condition, but others will have chronic progressive polyarthritis that creates serious joint impairment. There is no single diagnosis of rheumatoid arthritis, but 4 out of 7 of the following criteria have to be present in patients with RA. Morning stiffness, arthritis of 3 or more joint areas, arthritis of hand joints lasting for more than 6 weeks, symmetric arthritis lasting for more than 6 weeks, rheumatoid nodules, serum rheumatoid factor, and radiographic changes. Still's disease, though similar to RA, is more common in children, featuring inflammation and is characterized by a spiking fever, a rash and arthritis, pleuritis, and pericarditis. Still's disease and rheumatoid arthritis go hand in hand in diagnosing this 4-year-old child, discussed later on. Rheumatoid arthritis is a long-term disease that leads to inflammation or swelling of the joints and surrounding tissues. Arthritis is simply inflammation of a joint. It can also affect other organs. RA is due to an ongoing chronic condition in which part of the body becomes reddened, swollen, hot, and often painful, also known as inflammation, in joints that should move freely. Some patients experience gradual inflammation and pain in 5 or more joints, which is known as progressive polyarthritis, which can cause specific joints to stop working correctly. Diagnostic. Some symptoms have to be present in order to diagnose RA and Still's disease, such as arthritis in specific joints on both sides of the body, and an image produced on a sensitive plate or film by X-rays, gamma rays, or similar radiation. Radiographs can reveal erosions or bony decalcification or loss of calcium in bones in the involved joints and inflammation in the lungs or around the heart due to RA. The treatment. The patient was given naproxen to treat her fever and arthritis pain for 6 to 7 months and remained symptom-free for approximately a year. Then prednisolone was added to treat her inflammation and arthritis. Naproxen works by reducing hormones that cause inflammation and pain in the body, and prednisolone is a corticosteroid which works with hormone levels in the body to also reduce inflammation. With the decrease in pain, the patient could slowly be taken off naproxen and prednisolone. Later, Bryonia alba, followed by Saclac, a sugar pallet placebo, were added to her treatment for 1 week to help her with her fever and arthritis, and then reduced each week due to rapid improvement of the condition. Bryonia alba contains a resin that has a strong laxative effect that works to treat arthritis. This treatment was used for 1 month, and then the patient was prescribed sulfur 200 because it's one of the remedies that follow well after Bryonia with the same effects. Approximately 2 months later, there was no sign of arthritis and only slight ankylosis. 6 months after treatment started, the patient was completely taken off naproxen and prednisolone with extreme improvement in mobility.